Good afternoon, everyone. I finally wanted to touch on the subject of vaccines, and there's two very important stories that's coming out of the news that I want to cover with you with regards to that. And it just basically shows intent. And like I've said before, I'm not an anti-vaxxer, but I know nonsense when I see it. I know money when I smell it, and I know corruption and skullduggery the best, because the things that are going down right now with regards to the vaccine race around the world should have everyone up in arms, because a vaccine is something that's injected into your body. Just remember that. A lot of people think of it as something that will save your life, and I certainly thought that way for a very long time until I went to that one briefing at a hospital where I actually provided sound on the day for a company that promoted their vaccines and actually lambasted all the other companies that were currently supplying the hospital with their vaccines, saying how inferior it is, all the problems it causes, the deaths that it causes, the diseases that it causes. This opened my eyes, and I realized this industry is a mess, and is certainly not what it was set out to be when Pasteur and many other people tried their experiments at first. So there's two specific articles I want to cover, and both of them are in News 24. And the first one deals with widespread COVID-19 vaccinations not expected until mid-2021, the World Health Organization says. But the interesting thing says on News 24 is that this article is a link off from their live feed on COVID-19, because they're absolutely obsessed with this one most important thing. And it's a live feed that says World Health Organization expects widespread vaccinations against COVID-19 in mid-2021. So they actually changed the original headline, which says widespread COVID-19 vaccinations not expected until mid-2021, World Health Organizations, which shows you, I will bring you the evidence, that News 24 is a New World Order propaganda machine. And they will always try and bend something to make it sound very New World Orderish. But the other article that I want to cover is drug makers can produce unprecedented COVID-19 vaccine quantities, says UNICEF. Now, like UNESCO and many of the others in the World Health Organization, UNICEF is another United Nations spin-off New World Order stooge organization. And I can't be any nicer about it. And I want to cover that article first. It won't take too long. It says here 76 rich countries, they call them rich, join the World Health Organization Vaccine Alliance. So now we have an alliance of countries making vaccines, 76 countries. 76 wealthy nations are now committed to joining a global COVID-19 vaccine allocation plan, co-led by the World Health Organization, that aims to help buy and fairly distribute the shots. Okay? Then they say UNICEF says massive quantities of a COVID-19 vaccine could be produced. I'm sure they wanted to say B. The organization has joined the COVAX plan to distribute the vaccine. Not vaccines, they say the vaccine. UNICEF says 76 rich nations and 28 vaccine manufacturers, well, they can't spell that right because there's no R in the word, have joined the program. Unprecedented quantities of vaccines could be produced by 28 manufacturers in 10 countries over the next 2 years to tackle the COVID-19 pandemic, the UN Children's Agency UNICEF said on Thursday, as it announced it would help lead efforts to procure and distribute them. Why is the focus on children when we know that children are least affected by the SARS-CoV-2 virus? Ask yourself that question. UNICEF's role is part of a COVID-19 vaccine allocation plan known as COVAX and co-led by the World Health Organization that aims to buy and provide equitable access to the shots. What's that supposed to mean? So far, 76 wealthy nations committed to joining the COVAX effort. Remember that word COVAX. You'll still have nightmares from it. UNICEF said the 28 vaccine manufacturers had shared their annual production plans for COVID-19 vaccines through to 2023. So we can expect a 2-year rollout. A UNICEF market assessment revealed that manufacturers are willing to collectively produce unprecedented quantities of vaccines over the coming 1 to 2 years. But drug makers have signaled the projections are highly dependent on, among other things, whether clinical trials are successful. And this is where I'll get to the other article. Advanced purchase agreements are put in place. In other words, they want to know that people are going to buy it before it's even ready. Funding is confirmed and regulatory and registration pathways are streamlined. Regulation pathways, meaning they want to be able to not be held accountable if something happens when they give someone the vaccine. And in the other article, we'll look at all the problems related to that. Safe and effective vaccines are seen as essential to ending a pandemic that has so far claimed more than 864,000 lives globally. UNICEF's new, and remember, that is people that are claimed to have died of COVID-19 that have only contracted the virus. There's no proof that they died from COVID-19 at all. So those numbers are highly inflated. We know this for a fact. UNICEF's new role with COVAX stems from its status as the largest single vaccine buyer in the world. The UN agency said it procures more than 2 billion doses of vaccines annually for routine immunization and outbreak response on behalf of nearly 100 countries. So this is what UNICEF does. And you should maybe go and read up a bit more on UNICEF and their involvement with children and what they're doing to your children. So let's get to the other article, cut to the chase. Widespread COVID-19 vaccinations not expected until mid-2021, World Health Organization. So it's got a bad news headline, bad news leaning headline, where News 24 says that it'll be available at that time. A very positive headline for exactly the same thing. The US tells states to prepare for COVID-19 vaccine. The US Centers for Disease Control and Prevention has asked state public health officials to prepare to distribute a potential coronavirus vaccine to high-risk groups as soon as late October, documents published by the agency showed on Wednesday. This is just a headline under the picture in the article, and as usual I'll put links to the articles in the description beneath the video so you can go and view them. And please subscribe to the channel if you have not yet, and click the bell icon to get notifications for future videos. The World Health Organization expects widespread vaccinations against COVID-19 in 2021, next year. So widespread, we're going to get vaccinated. The organization said no vaccine candidates have demonstrated 50% efficacy. So what they're saying is what we have currently is rubbish. Western experts have questioned Russia's COVID-19 vaccine. Well, I've said all along it's a placebo, that Putin doesn't actually believe in vaccines. And they just wanted to stop the Russians from being injected with some rubbish. The World Health Organization does not expect widespread vaccinations against COVID-19 until the middle of next year, a spokesperson said on Friday, stressing the importance of rigorous checks on their effectiveness and safety. Now we know rigorous checks doesn't take a year, it takes years to do. So how on earth can they claim it to be rigorous at all if they want to do testing over a year? A lot of the responses to vaccines happen over decades. None of the candidate vaccines in advanced clinical trials so far has demonstrated a clear signal of efficacy at the level of at least 50% sought by the World Health Organization. Spokesperson Margaret Harris said, which means the WHO only looks for a 50% efficacy. This is their benchmark, and then they will roll that rubbish out. People, we are being taken for a ride, a big ride. Russia granted regulatory approval to a COVID-19 vaccine in August after less than 2 months of human testing, prompting some Western experts to question its safety and efficacy. Like I said, I think it's a placebo. US public health officials and Pfizer Inc. said on Thursday a vaccine could be ready for distribution as soon as late October. That would be just ahead of the US elections on 3rd of November, in which the pandemic is likely to be a major factor among voters deciding whether President Donald Trump wins a second term. we are really not expecting to see widespread vaccinations until the middle of next year, Harris told the UN briefing in Geneva. This phase 3 must take longer because we need to see how truly protective the vaccine is, and we also need to see how safe it is, she added. This referred to the phase in vaccine research where large clinical trials among people are conducted. Harris did not refer to any specific vaccine candidate. All data from trials must be shared and compared, Harris said. A lot of people have been vaccinated, and what we don't know is whether the vaccine works. At this stage, we do not have the clear signal of whether or not it has the level of worthwhile efficacy and safety, she added. Well, their level of worthwhile efficacy and safety is 50%. Well, if it was South Africa, it would be 30% or maybe 20%, like our pass marks in school. The World Health Organization and Gavi Vaccine Alliance are leading a global vaccine allocation plan known as COVAX that aims to help buy and distribute shots fairly. I spoke about it in the earlier article. The focus is on first vaccinating the most high-risk people in every country, such as healthcare workers. COVAX aims to procure and deliver 2 billion doses of approved vaccines by the end of 2021. So now we know the kind of numbers they're talking about. They're talking about 2 billion doses by 2021. But some countries that have secured their own supplies through bilateral deals, including the US, have said they will not join in this effort. And I find that interesting. Essentially, the door is open. We are open. What the COVAX is about is making sure everybody on the planet will get access to the vaccines, Harris said. Now, access is fine. I have no problem with access. What I do have a problem with is force, expecting me to be vaccinated, and then tracking, tracing, and or stopping me from entering certain areas if I have not been vaccinated. And this is the crux, and I'll be covering this in future. So thank you for watching this video. Remember to subscribe to this channel. Click the bell icon for notifications. And tonight we will have our last follow-up meeting in Gauteng. Tomorrow at 11 I will be doing my last Double Days meeting. And we'll be doing that in Boksburg. And from there we will go to Cape Town, and then we will set out our schedule for KwaZulu-Natal, where we will spend at least a month as well. So it'll be an extended stay, and then our visit to the other provinces along the way. So thank you very much for watching. Till the next video.